Thank you very much, everybody, and very happy to be here with you this morning to just share with you the overview of my research. So I chose this topic amongst many others because I feel like it will, through my sharing, hopefully you could see the underpinning theoretical framework as well as the motivation behind what I do as research. So this is an informal sharing. So if you do have any questions in the middle of my sharing, do please feel free to raise them so I can clarify. So it's a very short presentation. I've been told I have around 10 to 15 minutes. So this is my general outline for today's sharing. A little bit about myself and my research overview. So I would classify myself as having three key areas of research, but they have commonalities as they are underpinned again with my very curiosity, obsession with social innovation. So my first key research area is actually study the process of social innovation, its impact, as well as its antecedents. So policy and ecosystems, as well as how social innovation can engender age-friendly city. Those are more policy level or macro level type of research. But related to that is also the research on social enterprises, how organizational mechanisms can be designed in a way that facilitate the empowerment of people with disabilities. Related to the third area of research, marginalized women, as well as older adults. So all these three themes are underpinned again by an empowerment approach that sees really marginalized communities as part of the solution-making process, rather than a very hierarchical top-down approach, although we do need both. So I wanted to first just walk you through how I came about on this topic that I wanted to share with you today. So it really was from my observation, working, and also have a lot of friends in the sector working as in social enterprises, and why that type of work environment seemed to facilitate a sense of coherence as well as better quality of life, just by my observation first. But then, of course, we do need empirical evidence to attest to that. So I did first conducted a research with people with disabilities who were hired by social enterprises. And through this study, long story short, we came up of a conceptualization of meaningful work, and why it appears that within this conceptualization of meaningful work, and not just work status alone, is a better capturing of social inclusion of society. So we always just say it's not just whether or not you're employed. You can be employed but feel very excluded at the same time. So it's not just employment alone, but what we have conceptualized as meaningful work. So within this concept, this was a study conducted in around 2017. We found these four types of concepts within this conceptualization of meaningful work. So the first is capacity optimization. So the idea that it's a qualitative study. The idea that people, when they are assigned work tasks that are just challenging enough so that they feel stimulated, but so that they could also accomplish it. So the matching point needs to be grasped. So what happens is a lot of people with disabilities, unfortunately, key example, so people with visual impairment, I've heard a lot of times where they would come in, seek for a job, and once they, perhaps an HR person who sees them with visual impairment would immediately assign them to, you can just be a masseuse. There's a lot of stigmatizing assumptions about what they can't do, but in fact, those are false. Personal growth is something that everybody, including I think people here sitting here today, seeks in their job. But unfortunately, again, the personal growth is stunted amongst a lot of people with disability workers. They don't have a clear pathway to attain a better job positions, for example, because again, the idea is as long as you have a job, it's a win. But we're saying it's not enough, right? These two are interesting. It's more relational based, what we call relational based empowerment, and it's quite cultural specific. So we see a lot of the times in the data where they want to feel like they're filial sons and daughters, that they're able to make a contribution to their families, and that's quite specific. And the last is quite universal as well, which is the idea that they wanted to be a part of society rather than taken as something like a charity case. Like they actually want to feel like they want to normalize the fact that not just social enterprises, but corporations or public sector can also do that. So from this conceptualization, it led to my first ECS study that I wanted to test meaningful work. Okay, I wanted to test the relationship between meaningful work and the health of people with disabilities. And that's really, again, stemming from that qualitative study and also my observation that why is it that people who find their work meaningful, perhaps that's also a potential intervention for health as a social determinant. I'll save you from the hypothesis, but basically, these were the three objectives of my ECS, to examine relationships between health and meaningful work. And then also, because again, through the data, and it's a very iterative process where a lot of the people with disabilities themselves recognize not just systemic barriers or attitudinal barriers that they face from external parties, but many of them have very low self-esteem. Okay, of course, it's related to that interaction with the world, but studies have shown a lot of times where self-stigma actually, of course, lead to behavioral maladaptation, or they actually have a self-fulfilling prophecy where you would, because you believe you don't have a chance, then you don't go for the actual opportunity. And the third, which I think is interesting, where I wanted to shift the research and the relationship between the researcher and the participants to a more collaborative, on an equal footing kind of way. So I adopted more participatory and co-creation way through design thinking workshops to focus on the solutions and not just continually focusing on the problem. So this was what I did. It was a sequential mixed methods research design, and we worked with NGOs, social enterprises for recruitment, and I focused on people with visual impairment this time because I recognize, again, that there are a lot of disability-specific stigma. Sometimes the visibility of the disability would have an effect on how people interact with you. So that's how it came about. We collected about 302 people with visual impairment through the survey. All of them had work experiences before, and this was the results. So basically, the hypotheses that I formed were confirmed, whereby meaningful work was positively correlated with life satisfaction. So the more they found their work meaningful, the more satisfied their life is. But interestingly, the mediating effect was also found to be self-stigma. So of course, this was a limitation is a cross-sectional study and not a longitudinal one, so there are some limitations with causation, but at this very least, there was we found a mediating effect for self-stigma through life satisfaction. So not only can we draw on the conclusion where meaningful work could reduce, at least inversely related to the type of internalized sense of inferiority, but it also promotes life satisfaction. So that has some practical implications about how to draw meaning from work in a way that contributes to well-being. So this was published, our findings in this, I just summarized this. But not only this, so I was not satisfied with, right, only, okay, you have your confirmed relationships, so what? So the next step is obviously how to build that work environment that would be conducive to meaningful work. All right, so that led me to the third part of the study, which was design thinking workshops. So we actually went through the whole, the first 3 stages of the design thinking process, because there was, within feasibility-wise, no time for prototyping and testing. But we did, and there are a lot of tools for those of you who aren't familiar with design thinking workshops, this type of participatory, very action-oriented research. But one of such tools is using personas to guide participants to empathize of how these particular personas face various difficulties as they seek jobs and also as they work in particular settings. So these were also co-created with the consultation of NGOs to guide the sharing throughout this process. And we had 60 participants with people with visual impairment. Actually, it was quite challenging, but it was a huge learning process as well, because they can't see. So I had to describe everything as we conducted the research, but we managed to do it anyway. These are all the actual things and findings. So we consider these as qualitative researcher. This is all data for me when they put their notes and also some of their thoughts and process within how. Okay, so the guiding question was how to design a work environment that is conducive to well-being. This was then led to the publication of this paper. Again, part of that, right? So I think I'm running out of time, actually. So, but the findings, again, I think it led to a lot of myself having to reevaluate how we conceptualize work. And it's not just a particular, it could be a stressor, but it also could be flipped around as a sense of employment-based, as a base paradigm. So these are both, I think, theoretical and practical implications of this study. You can read it if you're interested. So based on that study, the last part is we know that NGOs and like stakeholders don't necessarily read academic papers. So based on that study, we also feedback to working closely with the NGOs to actually have some open access things in layman terms so that they could understand what the study has generated, and also for advocacy efforts. So we had press conferences and talking to relevant departments at the Labor and Welfare Bureau to advocate for more inclusive employment strategies. Yes, so this is all about the employment part as well. Okay, so next steps, final slide, okay. So remember at the beginning I said these were kind of my 3 key areas. And the next step, we actually, another colleague and I are the co-PIs for the Jockey Club Collaborative Project for Inclusive Employment. It's phase 2, it's a 3-year project, $50 million. And one of the outputs that we're going to come up with is to establish a standardized work capability assessment tools. So that is, I think I could stop here. But just to wrap up the overview is how the arc of my journey as a researcher, how try to build each stepping stone leading to more impactful change in society. So thank you very much.